Hey folks, can we talk? I've had a lot on my mind lately and not enough capacity to articulate it all, but I wanted to take this moment to revisit a theme I wrote about 3 weeks ago as the country began to slowly transition into shutdown. The article is entitled Social Implications of a Medical Disease, and it underscores my understanding that COVID-19 would impact some more severely than others as a consequence of massive social disparity across race, class, ability, gender, and generation. Public health practitioners call this the social determinants of health, which are the structural conditions in which people are born, grow, live, work, and age. It includes one's neighborhood and built environment, one's social and community context, their health and access to health care, and their economic stability and education. As COVID-19 demographic data trickles in from state and local departments, it's clear that the social determinants of this novel coronavirus are on full display, and the implications on those at the margins of society are alarming, to say the least. Since the pandemic reached American shores, I've been proclaiming with great confidence two things. Number one, you can't beat a public health crisis without 100% public health care access. And number two, viruses don't discriminate. The way in which we respond to viruses discriminates. Now, one is still 100% facts, but number two is only half true at this point. I was wrong. Viruses absolutely can discriminate. And COVID-19 is as racist as they come. In just the last few days, we've learned that Black people are dying from COVID-related illness at a breathtaking rate. Cities like Detroit and Chicago and Milwaukee and New Orleans are all reporting over 70% of their respective COVID-19 deaths being among Black people, with similar trends extending through the states at large. In New York City, which boasts the most cases in the country, Blacks and Latinos are dying at twice the rate of white people and 5 to 6 times more than their respective population percentages. Just yesterday, St. Louis is reporting that 100% of its known COVID-19 deaths are among African Americans. 100%. Now, let me tell you, as a Black man first and a scientist second, there is nothing about me biologically or anatomically or genetically that predisposes me to the coronavirus more so than anyone else. There's also nothing about my Blackness that makes me immune to it. In fact, most of the differences across the human race that exist are on the outside and not on the inside. Internally, we are more alike than we are different. Yet empire continues to erect these monuments of oppression on the basis of what separates us. Racist policies like redlining and voter suppression and the war on drugs and predatory subprime lending and Medicaid for some and the Tuskegee study of untreated syphilis in the Negro male and slavery. They've all had sneaky consequences that look like food deserts, which give way to obesity and diabetes and hypertension, consequences that look a lot like ghettos and over-industrialized areas where pollution is high, giving way to asthma and COPD, consequences that resemble a police state, which gives way to a constant state of trauma and that silent killer, stress, consequences that look like majority of Black people in the country residing in the very states that enslaved them 400 years ago under the leadership of the very people determined to keep them enslaved through disenfranchisement in the classroom and the boardroom and the courtroom, and yes, the emergency room. It's no coincidence that the southern region of the country, where the largest population of African Americans live, also accounts for the poorest people with the poorest health outcomes in states where Medicaid expansion is desperately needed but consistently rejected by the respective governments. So you'll find it no surprise that these same states are now ground zero for a national coronavirus epidemic that emerged in coastal areas of the U.S. just 1 month ago. Mississippi has the highest rate of COVID-19 hospitalizations in the country. It will be short over 250 hospital beds as it reaches its peak by the end of April if this trend persists. South Carolina and Oklahoma won't be too far behind. Now, all of These have been slow to issue stay-at-home orders and all share a common political ideology that has been no friend to black people. So believe me when I say that it's not a mistake that people of color have been disproportionately affected by the novel coronavirus. It's by design. Oppression is black people's pre-existing condition, and it has empowered a racist biological agent in COVID-19. Now, here's what I know. Many of us will continue to be exposed to the disease over the next few months, and most of us will make a full recovery. But many black and brown people won't. And those who do likely will not fully recover from the mental, emotional, and socioeconomic consequences of COVID-19 as a result of the extreme social inequities that existed long before the pandemic. So if we gain nothing else from this moment, I hope we gain truth. Truth that the real disease killing us is inequality. The Reverend Dr. Martin Luther King Jr. said it this way: of all the forms of inequality, injustice in health is the most shocking and the most inhuman because it results in physical death. He went on to say, I see no alternative to direct action and creative nonviolence to raise the conscience of a nation. King was right when he said it then, 54 years ago, and he'd be right today. Of all the forms of inequality, injustice in health is the most shocking and the most inhuman. And until we deal with the inhumanity of inequality, infectious diseases like COVID-19 will continue to be a lingering and debilitating symptom of a much larger cancer. Now, this is usually the part when I remind you that we all used to be somebody else, and that what's most important is we're always working to be better today than we were yesterday. And I still believe that, and I want you to believe it too. But mark MLK's words. If we don't take direct action and creative nonviolence to raise the consciousness of the nation, we're going to all be a bunch of self-improving people dying in a broken system determined to kill us. If in fact we are all experiencing this dis-ease together, as many would have us believe, then we all must be entitled to the same healing together. You be the cure you wish to see in the world, so we can be the cure the most vulnerable among us deserve. Peace and blessings.